Hello.
Good afternoon. Today I would like to educate you on why drug testing should be mandated for those individuals that receive public assistance. At the end of 2011, there were 108,592,000 people receiving public assistance in the United States, which was the highest increase yet. According to the Census Bureau, that equaled 35.4% of the 306,804,000 people in the United States at that time. The public assistance tallied included welfare and TANF, which TANF is Temporary Assistance for Needy Families. This is a chart to represent the growth in 2011 from quarter 1 to quarter 4, and you can see the increase is quite a dramatic jump of people that are receiving public assistance. It is agreed, though, that there is a legitimate need for the benefit programs like these for individuals who are struggling to get back on their feet, or for simply people that work but are not paid enough to support their families. However, the substance abuse issues have been part of the public assistance policy discussions for quite some time. States have an obligation to hold those on public assistance accountable for their actions. Receiving public assistance is a privilege, not a right. The debate on testing welfare recipients is simply the responsible use of tax dollars, says State Representative Kimberly Yee, a Republican who serves on the Health and Human Services Committee in the Arizona State House. Taxpayers should not be funding the lifestyles of those who are addicted to drugs and therefore condoning the illegal behavior. Opponents of the drug testing for those on welfare, however, believe that denying benefits to drug users unjustly punishes the families and takes away funds from the children. In fact, drug users themselves are the ones denying their own children the healthy lifestyle and the positive examples. Many states have talked about the idea of implementing drug testing for public assistance recipients. As of 2015 in February, at least 14 states have proposed legislation requiring some sort of drug testing or screening for public assistance recipients. The states include Connecticut, Illinois, Iowa, Kentucky, Minnesota, Mississippi, Montana, New York, Oregon, Pennsylvania, South Carolina, Texas, and West Virginia. Some testing applies to all applicants of public funding. Other testing sites include specific language that there is a reason to believe that a person is using drugs or has a substance abuse disorder. In other states require a specific screening process. For example, in 2009, Arizona established a program to test welfare recipients for drug use, but only if there was reasonable suspicion, which confronts abusers quickly and is able to get those individuals treatment needed quickly to become positive and productive members of society again. Drug testing, like that done in Arizona, could actually get other drug users and more substance abuse help if they were tested as well. By looking away, we are condoning illegal behavior. In El Paso County in Colorado Springs is actually the only county in Colorado that currently tests for welfare recipients for drug and alcohol, but only if those receiving assistance are suspected of the abuse. At this time, El Paso County does not know how much the drug testing will cost them or how many people they will test monthly. They feel that these unknown factors are a main cause and reason that other counties in Colorado have not followed suit to also begin testing. In El Paso County, 2,200 people walk through the Adult Services Building a month. Cheryl Schnell of El Paso County Human Services says, part of our goal is to reduce the challenges and barriers. Substance abuse is one of those challenges and barriers, meaning if a caseworker suspects someone is high, they will have to have a drug test. Recipients of assistance of a specific person, Kaylin Dowse, agrees, saying, you have to get drug tested to get a job out here, so they're not going to give you money for drugs. Since 1996, the Public Welfare Reform Program, states have proposed drug testing for individuals and public funds and have made changes to receiving benefits. For example, the Welfare Reform Law bars states from providing TANF assistance to persons convicted of felony of possessions, use, or distribution of illegal drugs. However, it does allow states to opt out of the ban or modify a period for which the ban applies. At least 5 states have modified the ban to those that require those convicted of drug or felony charges to comply with drug testing requirements as a condition to still receive those benefits, including Maine, Minnesota, Pennsylvania, Virginia, and Wisconsin. Furthermore, TANF recipients have to be working within 2 years of receiving benefits. This general mandate is reinforced by rules requiring states to reach fixed and rising work participation thresholds. By 2002, 50% of families receiving assistance in every state must have been engaged in work-related activities. So we all can agree that there is a need for public assistance programs. Many of us see a need every day on the public streets on a daily basis. Public assistance does benefit 34.5% of the public, but the assistance is a privilege, it's not a right. As taxpayers in America, we deserve the right to know where our money and how our money is spent. Drug testing is not uncommon for individuals in a workplace. For business owners, it's standard practice, and it holds employees accountable for their actions. If an employee does not pass a drug test, the consequence is simple: no job. In states like Arizona, if they test for drugs for people that have welfare, the consequence should be the same: no further taxpayer assistance. The need to trust is becoming more apparent. TANF has testing mandates, so do at least 15 other states plus El Paso County. Here's a map of the recipients of states for drug testing for welfare recipients in 2013. The dark blue states are drug-tested states where the law has been passed. The light blue is where there is pending approval. So as you can see, a lot of states have enacted these laws or are working on enacting these laws. Those that receive the assistance for legitimate reasons, like Kaylin of El Paso County, have nothing to hide, so therefore they'll agree to be tested and to continue to receive the benefits. State representatives and officials support drug testing for individuals on a public assistance need to continue to push for the laws to be passed. Drug testing for those on public assistance needs to be adopted nationwide. Public assistance is a privilege, not a right, and it needs to be treated like that. While many people agree with testing, not as many people are as vocal about it. And now is the time to stand behind your state representatives and vocalize your support. Get legislation to add the testing to their next ballots and monitor where your tax dollars go. Thank you. Done. It was a long one, 7 to 9 minutes. Thank you. And it didn't help because I ran out of paper upstairs, so I had to print it on purple. So that's, yeah. Now I have to actually download the speech and include the slideshow and put it in 2 different places. Thank you. And I got lucky. I registered for classes today, and I was registering for math. And when I was, let's see if that recorded. It's still recording.